So in this case, first of all, we must make sure that the diagnosis is just fatty liver and not due to other things. Yeah, because the SGOT and gamma GT go up. It can be because of also hepatitis. It can be other cause. So we need to double confirm, make sure that it's not just the fatty liver. Okay, fatty liver currently in the international agreement, the treatment is usually not by medication. Okay, yeah. So a lot of doctors will give medication, but the scientific proof is not strong. Yeah, the study that is conducted is not strong. So most of the time, the first way of treatment is actually proper diet and proper exercise. Not normal exercise, but I need to discuss what kind of exercise is required, especially for fatty liver. So the type of exercise for cardio, for the jantung, is not the same as the exercise for fatty liver. Yeah, that's sama. So we need to discuss a bit more to educate the patient properly how to remove the fatty liver. Yeah. So medication-wise, I try not to give. Yeah, there is some study that shows there is a high dose of vitamin E can help, but for men we cannot take vitamin E. Okay, there's a risk of prostate cancer. So also we need to know. Yeah, not everybody take the medicine happy then develop another problem. Yeah. So first of all, how do we know whether the Benjolan in the pancreas is not Kanker? Was there a biopsy or what is the diagnosis? Yeah. So the biopsy of pancreas, you must be very careful because you don't want, if it's a Kanker, you don't want it to biopsy, you don't want it to spread. So you must be careful how you biopsy also. Now, if it's truly not cancer, it's not Kanker, is it a pre-cancer condition? So if it's pre-cancer condition like some type of pancreatic cyst, then they should be removed as well. See, yeah. So it depends on the diagnosis. So it's important to achieve the correct diagnosis by proper imaging and sometimes by special technique in the biopsy. So you have two problems. One is many cysts in the liver and also has got multiple myeloma. So I think the problem of the low albumin and the other symptom most likely is coming from the multiple myeloma. Because if you have your multiple kysta in the liver, it's unlikely to cause the albumin to be so low. Yeah. So once you have a low albumin, then the chance of other problem will be higher. Like for example, bengkak kaki or cairan in the perut. So this cairan in the perut causing the bengkak perut may not be because of the cyst in the liver. So need to need to treat the multiple myeloma. Lymphoma doctor, but so by and large, it depends on the type of lymphoma. There are many different types of lymphoma. Then you need to look at the cell type. Some easier to cure. Some actually you don't even need treatment. Yeah. So there are some lymphoma that are very indolent. That means they don't harm the body. You know, you don't need treatment. So you need to know. At the end of the day, I will usually, for my patient, if they find lymphoma, what I usually help my oncologist do is to actually remove one of the lymphoma, and I need to test it. And this one can be done easily by keyhole surgery also. Yeah, so you need to see the cell type. Sometimes just a biopsy may not be enough. You may need to remove the lymph node itself. The question not so clear, but yeah, the liver is one of the organ to make cleaning the blood. Okay, so but of course it doesn't mean that when the person develop rash or itchy, it must be a liver problem. It may be some medicine they take wrong, allergy, and then it cause the rash and the itchy. Okay, so nothing to do with the liver problem. Yeah. Then the second part is about what type of checking should be done. Okay, so for liver it's very easy. You can look for Christian. He will recommend you to do some simple blood test, you know, and then you can see. And of course, the OST is helpful, yeah, to see whether there's really fatty liver or there's anything else in the sarang hati, sarang Empedu, any problem that can be treated. Yeah. The previous question, the person says that there are many cysts in the liver. Multiple myeloma doesn't cause the liver cyst. Yeah. So if it's really cyst, it cannot be because of the multiple myeloma. Yeah. Unless it is not a cyst, that means it's a solid nodule. Yeah. So if it's due to cyst, like what she said, in the liver, by treating the multiple myeloma, the cyst will not become smaller. Okay. Now, but if the tummy is big because of ascites, that means with the chiran, due to multiple myeloma. Okay, so multiple myeloma can cause albumin to be low, and because albumin low, there's ascites, there's chiran in the tummy. If you manage to treat the multiple myeloma, of course, the tummy will become less ascites because the albumin may improve. Yeah, so I'm not clear whether because the cyst in the liver is not due to multiple myeloma.
Jangan lupa like dan subscribe.